Red light therapy or Botox for wrinkles? Let's discuss. Over the past few weeks, there has been a lot of discourse online as to whether or not you should go after Botox or red light therapy for wrinkles, especially after this particular TikTok.
Thinking about getting Botox. What do you think?
For what purpose?
Smile lines and 11s.
I would suggest not doing it and simply using the red light, because Botox will essentially, the way it works is by shutting down the ability of the nerve to function properly, which stops movement of that specific area of the face. But then movement compensates because your face has many facial muscles, and expression through the face is just something that's very evolutionarily important. So you have to express things through the face. So you'll just create more and more lines on different parts of your face. Whereas the red light will thicken the dermal layer and actually literally stop, wrinkles. One of the things that's involved in it is sort of just the cells aging and breaking down on a macroscopic level, and red light treats that basically. So doing it now consistently forever is the greatest thing that you could do.
So you don't think I should get Botox?
I don't think you should get Botox.
So is one better than the other? Let's discuss. When it comes to wrinkles, there are two main types. Dynamic wrinkles, which appear when the muscles on your face contract, basically creasing the skin. There are also static wrinkles, which appear at rest, and static wrinkles largely are the result of age-related decline in collagen, as well as sun damage leading to a further collagen loss. While both red light and Botox can be effective for improving wrinkles, they address different types of wrinkles. So one is not necessarily better than the other. In fact, both of them can be used together and may be more appropriate to use together depending on you and what it is you aim to approach. What exactly does Botox do anyway? Well, Botox is kind of just an umbrella term at this point for injectables that are known as neuromodulators. But there are a lot of different brands of neuromodulators, each with their own slight technical differences, which we won't get into in this video, but they basically work to block the signal that comes from the nerve to tell muscles to contract. And when they're placed in a specific location, they basically help prevent the contraction of muscle groups, relaxing them so that you don't get that creasing of the skin, you don't get dynamic wrinkles. Injectable neuromodulators like Botox, however, do not address static wrinkles, which are wrinkles that are present at rest. Every time you move your face, dynamic wrinkles will be reinforced. So the goal of Botox is to basically paralyze certain muscle groups so as to make those groups of wrinkles not appear. One point made in this video regarding Botox that I want to dispel, because it is a bit of a misconception, is that if you get neuromodulator injection for wrinkles, by paralyzing certain groups of muscles, the other muscle groups in your face are going to be contracting more to compensate, so you're just going to get wrinkles in other parts of your face, and it doesn't quite work that way. It is true that sometimes with injectable neuromodulators, you can get somewhat of a tug of war, so to speak, with neighboring muscle groups, meaning you paralyze one group and the contraction of another group is more obvious. For example, when we're talking about injecting the 11th, this is a really common area that people want to target with neuromodulator, but you leave the frontalis, which is a forehead muscle, alone, you can actually get a little brow lift, which sometimes is a desirable thing in most cases. However, if you're someone who has more prominent dynamic wrinkles of the forehead, those might appear more obvious. This is actually a very easy fix, and is something that when you are seen by an experienced injector, they're going to evaluate your face globally. They're not just going to inject the 11s and ignore everything else. It's a myth that injectable neuromodulators are going to cause other muscle groups to overcompensate. However, it is true that injectable neuromodulators may open up room for more movement somewhere else. And again, that's something that's going to be addressed by your injector. They're going to assess for that before they just go injecting. It's a myth that getting Botox is going to cause wrinkles in other parts of the face. But what about red light? Red light therapy, more appropriately, is termed photobiomodulation or low-level laser therapy. This can be an effective treatment modality for an array of skin conditions as well as hair loss. In contrast to neuromodulators, the way that photobiomodulation with red and near infrared wavelengths of light works is that the energy from these wavelengths of light is absorbed by photoreceptors in the skin, and this has the effect of targeting certain pathways in the mitochondria of cells, and ultimately you get an improvement in ATP levels. Red light via photobiomodulation promotes production and remodeling of collagen 1, collagen 3, elastic tissue, and clinical studies, randomized controlled trials, demonstrate an improvement in moisture content in the skin texture, and photobiomodulation using red and near infrared wavelengths can not only improve wrinkles, also can help to improve telangiectasias. Those are those dilated blood vessels. People often refer to them as broken capillaries. They can occur as a result of an array of conditions. I have a whole video on these as a side note and all the different reasons why you might have them, but one of the most common reasons is sun damage. Photobiomodulation with red and near infrared light can help clear those up. Injectable neuromodulators, on the other hand, like Botox, are not going to change telangiectasias, and they're also not going to have a significant impact on overall skin texture. They're not going to improve skin hydration either, but both treatments can improve wrinkles. However, in contrast to injectable neuromodulators, low-level laser therapy, photobiomodulation, improves static wrinkles, not dynamic wrinkles. So which one is better for wrinkles? The answer is it depends on the type of wrinkles, your overall goal, what you have going on. And it may be such that you would benefit from using both. Botox is something that is administered by a professional in office, board certified dermatologist, plastic surgeon, certified injector. Red light therapy, photobiomodulation, can be administered in office. You also can do it at home. Injectable neuromodulators, you usually start to see the effects within a couple of days. Maximum effect is noted usually within about a week. Injectable neuromodulators, they last anywhere from 3 to 6 months, so it's not a permanent one and done thing. Low-level laser therapy, photobiomodulation, is something that is also not a one and done thing. In order to maintain the benefits, you need to continue using the device at home or coming in for treatment. Injectable neuromodulators are meant to improve dynamic wrinkles. There is a lot of discourse that you will run into online of people suggesting that getting injectable neuromodulator early on is preventative against wrinkles. While that makes sense, it's important to realize that claim has not been substantiated. I would never tell a young person to get injectable neuromodulator preventatively. Instead, I would tell them, as I tell everyone in every video, to sunscreen and sun protect, because that is going to help to ward off those static wrinkles. There is sort of an extreme approach online where people go above and beyond to try and not move their face. They won't drink out of a straw. I mean, all in the hopes of preventing dynamic wrinkles. And I feel like that is a bit extreme. I'm not going to give you any tips or suggestions on how to do that. But I will say one thing that I highly recommend people do that will help protect against both dynamic and static wrinkles is to wear sunglasses when you are outside. If you are outdoors and you find yourself squinting a lot, that is going to contribute to dynamic wrinkles, and you're also getting that sun exposure to the skin that's going to contribute to static wrinkles. Wearing sunglasses can theoretically protect against both, keeping you from squinting, and will protect some of the skin around your eyes, cutting down further on the formation of static wrinkles. Go on TikTok and very few people will point that out. Instead, they have these elaborate face taping routines and, different straws and things. But seriously, wearing sunglasses is one of the most logical things that you can do while outdoors. You don't need to wear sunglasses all day. That will protect against both static and dynamic wrinkles. Make sure that you get your eyes checked regularly. You may be developing nearsightedness. Recruiting those muscle groups to squint in an effort to focus far away. Glasses can remedy that and cut down on those dynamic wrinkles. The other thing that can help significantly for both dynamic and static wrinkle prevention is to not smoke. Smoking really destroys the collagen in your skin, especially around the mouth, and you are contracting those muscles for holding on to the cigarette in your mouth, and that really does contribute further to those dynamic wrinkles around the mouth. The thing about doing photobiomodulation at home is don't invest in these devices if you are not committed to using them regularly. As I said, the results that you get are only as good as you are at maintaining using the device. As soon as you stop, within time, everything will kind of go back to the way it once was. So it's not a miracle cure by any means, but it definitely can help. I found it personally to be very effective as someone with a tendency towards dry skin for improving moisture retention as well as for plumping and smoothing. I really did see a visible improvement in skin texture, but I haven't used it in a while. I'm actually considering strongly starting up again because it was so effective. My nighttime routine at the time kind of got a little complicated and became sort of difficult for me to do it regularly. And B, I wanted to test out some other things to review on this channel, so I didn't want the background effect of the device. So I stopped using it, but I'm seriously considering restarting it again because it was something that truly made a visible difference in my skin. All right, you guys, that's the rundown between neuromodulator versus photobiomodulation or red light therapy. I hope this video was helpful to you guys in terms of clarifying the two and their usage for wrinkles. While these things are useful for wrinkles, both treatments are used for many medical conditions. For example, Botox, neuromodulator, injectable neuromodulator, very effective for hyperhidrosis, excessive sweating, which can be quite debilitating and aggravate underlying skin conditions and put you at risk for skin infections like fungus. Also, very effective for torticollis, migraines, blepharospasm. There's even mounting evidence that it can be helpful for rosacea. Photobiomodulation, low-level laser therapy, effective for hair loss. That's one of the first things that it was discovered to be useful for actually back in the 60s. Also very helpful for wound healing, so keep that in mind too. Let me know in the comments, have you tried either of these? Speaking of me testing out devices, on the end slate I'm going to put my recent review where I tried out, tested out, and reviewed the Medicube device for electroporation. So check that out next if you missed it. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.